All right, so I'm going to show you our medicine routine, and this is for morning and for the nighttime. So the first one that I usually do is his Depakote. Looks like this. It's in a liquid form, and he's been on this for about a year. This is probably the most easily found in the pharmacy because it is pretty common and it's commonly used for other illnesses, disorders, and whatnot. The next one that we do is clobazam, and this is a benzodiazepam. So he's been on this for almost 2 years. This one's a controlled substance, so it's very difficult to find in the pharmacy. It's special order, and if we don't order it, or we don't get it, or they don't have it, we are usually in really big trouble because it is not easily found in other pharmacies. So he does this one. This is also one of the medications that if he were to ever have to wean off of this, it would be very difficult because it is a benzodiazepam, which means his body gets used to it. The next one that we do that we just started this past fall is a pain in the butt. So this one is called Pental, and it's fairly new on the market for kids with Dravet Syndrome. It wouldn't typically be used for any other child with epilepsy. It's specifically for Dravet. So when we get it ordered specially, we're able to do that because we have that diagnosis, and it is a powder. And he recently just also went up on this medication because he had a seizure a couple of weeks ago. So then we take this and you put it in the water and you draw up 100 milliliters of water. In between, I usually stir it because it is a powder. So I do 35. And then I do 30. So it's a total of 100 milliliters of water in one packet, and then we stir it up. So it's pink, looks like this. I think it tastes pretty good for him because he doesn't mind taking it, and he calls it the candy medicine, so it's kind of funny. So because he recently went up on this medication, we do draw it up to 35. These syringes only go to 35, so we do 135 mLs. It looks like a lot, but when you think about an ml, they're really small. And then 10 more, so he's on 45 total. Okay, so then we have our Pental. Usually get rid of that. Our Depakote, our clobazam. That's 3 so far. Then we do, only at night, we do vitamin D. And this is because he has low vitamin D. And we typically only do about 2.5 mLs of that. So I'll draw that up. And then the last one that he does, which we are very grateful that he is good at taking pills, which most toddlers are not. He is taking something called guanfacine, and this is for his hyperactivity that's associated with Dravet syndrome. It is a non-stimulant. It's a very small pill. We cut it in half. We give him half in the morning and half at night, and it is typically used for blood pressure in adults, but for children with symptoms of hyperactivity who don't want to use a stimulant, we use this. So 1, 2, 3, 4, 5 medications, which is actually pretty decent considering he used to be on like 6 or 7. So Thanks for coming to my little TED Talk on Thomas's medications. I think it's really important to kind of let everybody know what these medications are, why he's taking them, and I just want to spread awareness for Dravet and just kind of, get the ideas out there about his medication. So, thanks.